13 deadly symptoms of pancreatic cancer that no one tells you. Did you know that pancreatic cancer is one of the most lethal and difficult to detect? Ever wondered why this type of cancer is called the silent killer? What would happen if you could spot the signs before it was too late? Pancreatic cancer is one of the most feared diseases today, often diagnosed only in advanced stages when treatment options are limited. Located behind the stomach, the pancreas is a vital organ that performs essential functions in our body, including controlling blood sugar levels and producing digestive enzymes. When something goes wrong, our body starts sending warning signals, but most people don't know how to interpret them correctly, allowing the disease to quietly advance. Why do so many people ignore these signs until it's too late? Let's get started. 1. Mysterious clots, the warning sign that could save your life. Blood clots are the body's natural response to prevent excessive bleeding in case of injury. When they appear for no apparent reason, they can be a warning sign of something much more serious, such as pancreatic cancer. This condition, called thrombosis, can occur in the veins of the legs, known as deep vein thrombosis. In more serious cases, it can affect the lungs, causing a potentially fatal pulmonary embolism. In the context of pancreatic cancer, the formation of clots is related to substances released by the tumor. These substances can alter the body's natural balance, increasing the tendency of the blood to clot. In addition, cancer can trigger systemic inflammation that contributes to the formation of clots. A recent study from Harvard University revealed that pancreatic cancer patients are up to 6 times more likely to develop unexplained blood clots. These clots can cause symptoms such as swelling, pain, and redness in one of the legs, or sudden shortness of breath if the clot travels to the lungs. One of the challenges is that clots can easily be attributed to other health problems, or even ignored, especially when symptoms are mild. Therefore, it is essential to pay attention to additional signs. Many people with pancreatic cancer only discover the disease after complications related to blood clots. Never underestimate this symptom, especially if it appears suddenly and without an apparent cause. Clots are a sign that something is not working as it should in the body. Would you ignore a light alert on your car's dashboard? So why ignore your body's signals? 2. Unexplained burnout, when sleep is no longer enough. Feeling tired after a busy day or a bad night's sleep is normal. But what happens when the feeling of tiredness is constant, deep, and does not improve even with rest? This persistent fatigue could be a symptom of something much more serious, such as pancreatic cancer. In the case of this type of cancer, fatigue is caused by a combination of factors. One of the most common is nutrient malabsorption due to the inability of the pancreas to produce enough digestive enzymes. This means that even if the person is eating, the body cannot extract the necessary energy from food. In addition, pancreatic cancer can cause loss of appetite, further aggravating the lack of energy. Cancer-related fatigue isn't just ordinary tiredness. It's exhaustion that consumes your body from the inside, even when you seemingly do nothing. Another significant factor is the impact of cancer itself on metabolism. The body spends a huge amount of energy trying to fight off the disease, which can lead to exhaustion. Treatments such as chemotherapy can also intensify fatigue, adding side effects such as weakness and a reduction in the body's ability to recover. Cancer-related fatigue is different from simple tiredness. It is persistent, profound, and affects the ability to perform even the simplest daily tasks. It's not something that goes away with a good night's sleep or a period of rest. This type of fatigue can be a major warning sign, especially when combined with other symptoms. Often, people underestimate fatigue, attributing it to stress or age. If you or someone close to you is experiencing persistent fatigue that doesn't get better, don't wait any longer to seek medical help. Ignoring this signal can be the same as turning off the fire alarm during a real fire. 3. The secret code in your stool and urine that can reveal a tumor. Changes in the color of the stool or urine can be subtle, but very important signs of serious problems in the body, including pancreatic cancer. Normal stools are usually brown in color, while healthy urine ranges from light yellow to amber. When these colors change significantly and persistently, the body may be trying to warn you that something isn't working as it should. In the case of pancreatic cancer, tumors can block the bile ducts, disrupting the normal flow of bile. Bile is responsible for the color of stool, and when its flow is blocked, stool can become clear, whitish, or even grayish. This change is a clear sign that the biliary system or liver may be affected. Your excretions contain vital codes about your health. Learn to decipher this body language, and you can detect a tumor before conventional tests even do. In addition, urine can become significantly darker, even with adequate hydration. This darkening occurs due to the accumulation of bilirubin in the blood, which instead of being eliminated through the feces, is excreted by the kidneys. These signs may be accompanied by other symptoms, such as jaundice, itchy skin, or abdominal discomfort. Changes in stool consistency, such as greasy, strong-smelling stools, can also be an indicator of pancreatic cancer. These changes occur because the pancreas is not producing enough digestive enzymes to break down fats, proteins, and carbohydrates. This condition, called malabsorption, can lead to severe nutritional deficiencies and weight loss. While changes in stool or urine can be caused by other factors, such as diet, infections, or medications, it's essential not to ignore these changes when they're persistent or associated with other symptoms. Pancreatic cancer is known to be a silent killer, but the body often gives early warning signs. If you notice unexplained changes in the color or consistency of your stool or urine, see a doctor. Do you wait until your cell phone battery dies to recharge it? So don't wait until your body stops working to take care of it. 4. Yellowish skin, the visible sign of an invisible battle. Jaundice is one of the most visible and worrisome signs that can indicate pancreatic cancer. This condition causes yellowing of the skin and whites of the eyes due to an increase in bilirubin in the blood. Bilirubin is a yellow pigment that the body produces when it breaks down red blood cells. Normally, bilirubin is processed by the liver, mixed with bile, and eliminated through the digestive system. But when there is an obstruction in the bile ducts, such as a tumor pressing on these ducts, bilirubin builds up. This results in the characteristic yellowish color of jaundice, which can be easily identified. In addition, jaundice can be accompanied by other symptoms, such as dark urine, light-colored stools, and intense itching of the skin. Yellowing your skin isn't just a cosmetic problem, it's your body screaming for help as an invisible enemy attacks your vital organs. These signs are more than just a nuisance. They are a warning that something is wrong in the liver, biliary system, or pancreas. In the case of pancreatic cancer, jaundice may be the first noticeable symptom, even before other signs appear. This is because tumors located in the head of the pancreas, one of the most common areas for the development of this type of cancer, can quickly block the bile ducts. People often ignore the early signs of jaundice, associating them with less serious problems, such as tiredness or poor diet. This procrastination allows the cancer to advance silently. Therefore, it is crucial to seek immediate medical attention when you notice any yellowish tinge on your skin or eyes. Jaundice can have other causes, such as hepatitis, cirrhosis, or gallstones. But a medical examination is essential to determine the source of the problem. Identifying this symptom early can make all the difference in pancreatic cancer treatment. Can you distinguish between being tanned and being yellow? This distinction may be the difference between life and death. 5. Alarming weight loss. When losing weight is a mortal danger. Losing weight without dieting or exercising may seem like a dream to some, but in reality, it is a sign that should not be ignored. Unexplained weight loss, especially when it occurs quickly and significantly, can be a warning of serious health problems, including pancreatic cancer. This type of cancer can cause weight loss for several reasons. Primarily, the pancreas plays a crucial role in digestion by producing enzymes that help the body absorb nutrients from food. When the pancreas does not function properly due to the presence of a tumor, these enzymes are reduced, resulting in malabsorption of nutrients. Without the necessary nutrients, the body begins to burn through its own energy reserves, leading to weight loss. Those mysteriously disappearing pounds aren't a gift from the universe. They're a silent alarm that your body is being consumed from within. In addition, tumors in the pancreas can put pressure on the stomach, creating a feeling of early satiety. This means that the person eats less because they feel full quickly, making weight loss even worse. Another factor is the increased metabolism caused by cancer. The body, when fighting the disease, uses more energy than normal, which also contributes to the reduction of body weight. People often don't notice weight loss right away. It can start subtly, with clothes getting looser, or comments from friends and family about how thinner you are. However, a loss of more than 5% of body weight over a period of 6 months to a year, without lifestyle changes, should be cause for concern. While weight loss can be caused by other conditions such as diabetes, thyroid disorders, or stress, it is essential to seek medical help to investigate the cause. In the case of pancreatic cancer, weight loss is often accompanied by other symptoms. If you're losing weight effortlessly, celebrate the moment, but also see a doctor right away. 6. The treacherous back pain that doctors often overlook. Back pain is a common problem that affects millions of people, but when it intensifies when lying down, it can be a warning sign of something more serious. In the case of pancreatic cancer, this specific back pain can be an often overlooked symptom, mistaken for muscle or postural problems. The pancreas is located deep in the abdomen, near the spine. When a tumor grows in this organ, it can put pressure on nerves and adjacent structures, causing pain that radiates to the back. This pain has particular characteristics that distinguish it from other types of low back pain. It is usually persistent, does not relieve with rest, and can worsen when the person lies down. Many patients report that the pain is most intense during the night, disrupting sleep and significantly affecting quality of life. Back pain that intensifies at night isn't just insomnia. It could be your body trying to warn you of a lethal growth putting pressure on your vital organs. It is common for primary care physicians to initially attribute this pain to musculoskeletal problems, especially in patients with a history of low back pain. This incorrect assessment can lead to late diagnoses, allowing the cancer to advance silently. Pancreatic cancer-related back pain often does not respond well to common pain relievers. If you're taking pain medications without getting relief, this could be a clue that something more serious is going on. Another warning sign is when the pain is accompanied by other symptoms, such as unexplained weight loss, constant fatigue, or digestive problems. This combination of symptoms should always trigger an alert to seek further medical evaluation. Unfortunately, because back pain is extremely common, many people postpone their doctor's appointment, opting for self-medication, or simply tolerating the discomfort. This delay can be crucial in the case of pancreatic cancer, where early diagnosis can make all the difference. If you have back pain that intensifies at night and doesn't improve with conventional treatments, don't wait any longer to investigate. The difference between common low back pain and a cancer symptom may be in the time when you feel the most pain. This small detail can save your life. 7. Your gut is screaming for help. Alarming digestive signs. Digestive problems may seem routine to many people. Nausea, vomiting, diarrhea, or constipation are symptoms that we usually associate with something we eat or episodes of stress. But in some cases, these signs can indicate something much more serious, such as pancreatic cancer. The pancreas plays an essential role in the digestive system. It produces enzymes that help break down fats, proteins, and carbohydrates so that the body can absorb the necessary nutrients. When cancer affects the pancreas, this function can be compromised, resulting in symptoms such as poor digestion and significant changes in the stool. One of the most striking signs of digestive problems related to pancreatic cancer is the presence of pale, fatty stools, known as steatorrhea. When your digestive system fails repeatedly, it's not just food poisoning. It can be a sophisticated alert system, signaling that a silent killer has invaded your body. This occurs when fats are not properly absorbed by the body due to a lack of pancreatic enzymes. This stool can have a strong odor and float in the water, indicating that something is not right. Another common symptom is the feeling of nausea or frequent vomiting, which can be caused by a tumor blocking the normal flow of food through the digestive tract. Additionally, many people report abdominal discomfort and bloating after meals, even when they eat in small amounts. These digestive problems can lead to serious nutritional deficiencies, as the body cannot extract the necessary nutrients from food. Over time, this can cause weight loss, weakness, and a general feeling of malaise. The big challenge is that digestive symptoms can easily be attributed to less serious problems, such as gastritis or food intolerances. Therefore, people often do not seek medical help immediately, allowing pancreatic cancer to progress silently. If you notice ongoing digestive issues that resist common treatments, don't wait any longer to see a doctor. When your stomach complains persistently, it's not just indigestion. It could be the first whisper of a deadly disease that needs to be heard right now. 8. When your body rejects food, the silent warning that no one notices. Loss of appetite is a symptom that often goes unnoticed. It may seem temporary, caused by stress, flu, or even mood swings. However, when the lack of desire to eat becomes persistent and unexplained, it's time to pay attention. This condition, called anorexia in medical terms, is a common symptom in people with pancreatic cancer. In the case of pancreatic cancer, there are several factors that can cause loss of appetite. One of them is the presence of a tumor that compresses the stomach, creating a feeling of early satiety. The person feels full after eating only a small amount of food, discouraging them from continuing to eat. In addition, cancer itself can alter the signals the body sends to the brain, changing the perception of hunger and anxiety. When the mere idea of eating your favorite dish causes repulsion, your body may be waging a silent battle against cancer cells that you don't even know exist. Another factor is the impact of cancer on the senses, such as taste. Foods that were previously enjoyable may taste altered, and this can discourage a person from eating. In some cases, cancer treatment, such as chemotherapy, can also contribute to loss of appetite by causing nausea or changing the flavors of food. Loss of appetite in pancreatic cancer is particularly concerning because it can lead to a condition called cachexia. Cachexia is characterized by a significant loss of weight and muscle mass, even when calorie intake is adequate. This condition weakens the body, reducing the patient's ability to resist treatment and affecting their quality of life. In addition, lack of appetite can aggravate nutritional deficiencies, resulting in fatigue, weakness, and increased vulnerability to infections. Therefore, it is important to note if the loss of appetite is accompanied by other symptoms. If you or someone you know is experiencing a persistent lack of appetite, don't ignore this sign. Losing interest in food isn't just a habit. It's a vital communication that something is disrupting your body's fundamental processes. 9. Sudden diabetes after 50. The biological clock that can announce a tumor. Diabetes is a well-known condition and is usually associated with factors such as obesity, physical inactivity, or family history. But the sudden onset of diabetes, especially in people over 50, with no apparent risk factors, can be a sign of something more serious: pancreatic cancer. The pancreas plays a key role in regulating blood sugar. It produces insulin, a hormone that allows the body's cells to absorb glucose to produce energy. When a tumor develops in the pancreas, this insulin production can be compromised, resulting in high blood sugar levels. This dysfunction can lead to the development of diabetes, even in individuals who have never had problems with glucose before. When diabetes appears without warning in old age, it's not just a coincidence of aging. It could be your pancreas giving in to a deadly invasion that began months earlier. What makes this relationship even more alarming is that in some cases, diabetes can be the first sign of pancreatic cancer, even before other symptoms appear. The onset of diabetes may indicate that something is wrong with the pancreas. Symptoms of new onset diabetes include excessive thirst, frequent urination, fatigue, blurred vision, and in some cases, unexplained weight loss. These signs should be taken seriously, especially if they occur abruptly and without an obvious cause, such as dietary or lifestyle changes. Although not all cases of new onset diabetes are related to pancreatic cancer, it is important to investigate this possibility, especially in older people or those with a family history of cancer. Another relevant aspect is that, in some patients with pancreatic cancer, diabetes can disappear after treatment of the tumor. This reinforces the direct connection between pancreatic function and blood sugar control. Unfortunately, many people do not associate the onset of diabetes with something as serious as cancer. This lack of awareness can delay diagnosis and allow cancer to advance quietly. The onset of diabetes in midlife isn't just a metabolic problem. It may be the first warning of a much more serious disease hidden behind seemingly common symptoms. 10. Desperate itching. The annoying symptom that may indicate terminal cancer. Itchy skin may seem like a trivial problem, but when it's persistent and intense, with no apparent cause, it can be a sign of something more serious, such as pancreatic cancer. This unusual but significant symptom is often linked to the accumulation of bile salts in the blood. In the context of pancreatic cancer, tumors in the head of the organ can block the bile ducts, preventing the normal flow of bile to the intestine. This obstruction leads to the retention of bile salts in the bloodstream, resulting in itching, known as pruritus. The itching associated with pancreatic cancer is often more intense at night, making sleep a challenge. It may not be accompanied by a visible rash, which causes many people to delay seeking medical help. That unbearable itch that keeps you up at night isn't just a dermatological problem. It could be your body screaming about toxins that should be eliminated but are circulating in your blood. Another important sign that often accompanies this itching is jaundice, characterized by the yellowish color of the skin and eyes. This happens because the same blockage that causes bile salts to build up also results in elevated levels of bilirubin in the blood. Although itching can be caused by various conditions, such as allergies, dry skin, or dermatological problems, it is essential to investigate whether it persists or is accompanied by other signs. This symptom is not only uncomfortable, it is the body trying to warn that something more serious may be happening. Chronic itching can affect quality of life, causing irritability, difficulty concentrating, and even skin sores due to repeated scratching. Even more alarming, many people do not associate this symptom with problems in the pancreas, delaying the diagnosis. If you're experiencing persistent, unexplained itching, especially if combined with other signs like weight loss, abdominal pain, or changes in your stool, see a doctor immediately. The difference between a common skin irritation and a cancer symptom may lie in the persistence and intensity of the itching. This seemingly small detail can be vital in saving your life. 11. The alert mind. When depression is a scream from your pancreas. Sudden, unexplained depression can be more than an emotional upset. It can be one of the first signs of pancreatic cancer. Studies show that up to 33% of patients with this type of cancer have depressive symptoms even before diagnosis. This is because the pancreatic tumor can release cytokines, chemicals that cross the blood-brain barrier and interfere with the brain's neurotransmitters, affecting mood. In addition, the metabolic stress caused by cancer can cause hormonal changes that contribute to depression. Unlike regular depression, this form does not usually have clear emotional causes, does not respond well to antidepressants, and is accompanied by persistent fatigue and apathy. The problem is that doctors and patients rarely associate these mood swings with serious physical illnesses, which delays diagnosis. Although depression alone is not proof of cancer, when accompanied by other symptoms such as weight loss or abdominal pain, it requires immediate medical investigation. 12. Persistent abdominal pain, the deadly secret hidden in your belly. Abdominal pain is one of the most common and often ignored symptoms of pancreatic cancer. Located in the upper abdomen and often radiating to the back, this pain can feel muscular or digestive. However, in the case of cancer, it is caused by the growth of the tumor, which presses on surrounding organs and nerves. The pain tends to worsen after meals or when lying down, and over time, it can become constant and intense. Because it is easily confused with problems such as gastritis or reflux, many postpone seeking medical help, which compromises an early diagnosis. Additional signs, such as weight loss, stool changes, or jaundice, should raise an alert. The pain caused by pancreatic cancer is progressive and does not go away. Therefore, persistent pain in the abdomen requires immediate medical attention. Listening to the body's signals can save lives. 13. The food revelation. When your body starts rejecting foods you've always loved, many people suddenly notice that they can no longer digest certain foods that have always been part of their routine. This new intolerance, especially to fatty foods, may be more than your average digestive change. It may be an early sign of pancreatic cancer. The pancreas, when compromised by cancer cells, loses its ability to produce essential digestive enzymes, making it difficult to digest fats and causing symptoms such as bloating, gas, diarrhea, and discomfort after meals. Unlike common food intolerances, which usually appear gradually or from childhood, the one related to pancreatic cancer is sudden and selective, especially affecting dairy products, fatty meats, and fried foods. An associated symptom is steatorrhea, greasy stools with a strong odor. Unfortunately, these changes are often attributed to aging, stress, or irritable bowel syndrome, which can delay diagnosis. Studies show that about 40% of patients with pancreatic cancer reported the appearance of new food intolerances up to a year before diagnosis. Therefore, adults over the age of 45 should be aware of these changes and seek medical advice when they notice sudden changes in digestion. In addition to food intolerance, other symptoms that may indicate pancreatic cancer include persistent fatigue, changes in stool or urine, yellowing skin, unexplained weight loss, back pain, loss of appetite, sudden diabetes, severe itching, ongoing abdominal pain, depression, and unexplained blood clots. Pancreatic cancer is insidious precisely because it does not present clear symptoms in the early stages. Therefore, recognizing these signs can be essential for an early diagnosis and a greater chance of successful treatment. Ignoring changes in the body can be costly. Consulting a doctor in the face of any unusual symptoms is an act of care and wisdom. Adopting healthy habits, such as good nutrition, physical exercise, and regular medical checkups can prevent future complications. Your health is a precious commodity. Take care of yourself today to have a healthier and more lively tomorrow.